What should health system pharmacists know about HRSA audits?
What they should know about HRSA audits is, and again, HRSA stands for Health Resources and Services Administration, which is the federal department that's responsible for, they house the Office of Pharmacy Affairs, which is the department responsible for oversight and administration of the 340B program. And they are auditing entities. They're also auditing manufacturers. And what I would say is the covered entities need to realize that this responsibility for the program, running a compliant program, cannot be transferred to anyone else. They have to take full responsibility. There's a lot of different things we teach at the 340B University program. I mean, talking about audits, we did a session just yesterday here before the ASHP meeting, university, with 230 attendees, and we have a whole session dedicated to audits. We just did a session over across the hall, and they were talking about their audit activity. The auditors are getting more and more sophisticated. So it started out that they didn't know a whole lot. They were just learning about the healthcare system and how things operate. Now they've got that down and they're hiring more auditors. So the audits are getting more sophisticated. They're getting into great detail. And so you're going to need to know how to talk about and show how your systems operate and run compliant programs. And then they're going to take a sampling of data, and you're going to have to be able to walk through that and show the audit trail of how that meets all the requirements of an eligible prescription. So, audits are important. This is important from HRSA's perspective because you may be aware that the OIG and the GAO have both been critical of HRSA in the past. Well, as of recently, there was Energy and Commerce Committee meetings where they both testified, GAO and the OIG, and they gave HRSA credit for making great strides and improvements in improving the integrity of the program. But they said they want to keep the pedal down, need to continue to make progress, and there is where Apexus is working closely with HRSA to help in the education area and in the compliance areas. Our goal is to work with covered entities to ensure they can run compliant programs. And HRSA, their goal is not to have a punitive process here. It's to make sure that they're doing their job to do the checking and balancing, but we can do everything within our power to help the customers get there. And that's working with all stakeholders, by the way. Like when we do our universities, we have the faculty members are from the industry, the wholesaler community. We cover the whole gamut. We bring auditors in, so we're bringing all the different stakeholders' views into those programs so you have an excellent dialogue about best practices.